looked down and I was drenched in the room. It all blacked out. Then I remember waking up in the ER. I felt my face very heavy, and I'm like, something's not right.
My name is Luke, and I'm from Southern California. And I have a lot to get off my chest. I have an indentation in my left side. On the right side, I have a man. I was born and raised in California. I was actually born female. So growing up, I would steal my brother's clothes. And like, I would take, dolls that I had, and I would cut their hair off, and I would tape it to my face. Like, that's just how much I wanted to look masculine. My parents, they would ask, do you want people to think you're a lesbian? Do you want people to think that you're a boy? And in my head, I'd say, yeah. And it was very hard. It was very hard to hear that and feel like I was disappointing them by just being who I was in high school. I really dove into theater because it's so open, and that's where I met my first gay friends, and it was just completely clear at that point, holy crap, I'm transgender. In the female-to-male transgender world, chest masculinization surgery is usually known as top surgery. I mean, I watched all of these people on YouTube, and for me, it was kind of like that extra tipping point of it's real, it's tangible. I actually found my surgeon online. I made an appointment. The surgeons originally said, it's probably going to be 2 surgeries, but it's going to look normal. As I was healing from the second surgery, in my opinion, it looked worse than when I started. The indentation was just extremely noticeable, and the swelling on the other side was like I had a man still. I knew I had to go in for a 3rd surgery. The results were definitely better than before, but it was not enough. After the 4th surgery, it actually got infected and completely reversed everything that they did. I definitely wasn't happy with that. It wasn't what I spent pretty much my life savings on.
So this is the tough side, right? The dent. That is one of the hardest things to fix. Many plastic surgeons consider it actually unfixable. There's no supporting tissue behind the areola.
Caved in.
Yeah. There's very little vascularized tissue to potentially rotate in, and I'm gonna have to think of something creative in order to get volume behind the areola to project it out. This is one of those procedures where you make it up when you get there. I can promise you this. I'm gonna come up with a solution.
Okay.
And I'm gonna do the best that can be done.
Before my surgery, my chest was dented on the left side and overinflated on the right. Now, after surgery, I have the pecs I always wanted. I'm finally the me on the outside that I've always been on the inside.
Hi.
Tracy, hi, Dr. Nassif.
Nice to meet you, Tracy.
Nice to meet you.
Hi, Tracy.
Nice to meet you,
Terry
Jamie.
Dubrow, nice to meet you. Terry Dubrow, pleasure.
Hi.
Please have a seat. Well, welcome.
Thank you very much.
So how many years ago did you have your nose done?
Gosh, 30 years ago now.
Okay.
Decades ago, the thing to do with the rhinoplasty was take out as much cartilage as possible. That's exactly what happened to Tracy. The doctor went crazy on her nose.
Was just a young, insecure kid growing up. And as I grew, my nose became a little bit bigger than I wanted it to be, and I was very self-conscious about it. And at 16, I was begging and got it Christmas break of my junior year.
Yeah.
And it turned out great.
Yeah.
But definitely once I hit my 20s, I noticed the 2 horns, for lack of a better word.
That's the first thing you
These 2
noticed.
things I noticed, yeah. And it's gotten worse and worse. So I sit there and wonder, am I gonna wake up one day and it's just gonna be completely collapsed in?
When I see a lot of patients that have had a rhinoplasty years ago, they usually stop progressing maybe after about 15, 20 years. But Tracy's 30 years out, and she continues to get worse. Now, that is unusual.
I think doing this is going to make her more confident, and I think she's going to be just more happy within herself.
I've had little kids come up to me.
Yeah.
What's wrong with your
Your
nose?
nose.
Right.
And it's one of those, I laugh it off. Just want it to look, I guess, I hate saying normal, but normal.
You got really thin skin there.
Really
Yeah.
thin skin.
You're collapsing in the middle part of your nose.
When you see the type of collapse that is seen in Tracy's nose, that's an indication that most of the cartilage has been removed, and she's going to need a lot of surgery and support to keep the nose from collapsing in the future.
There's 2 pieces of cartilage in your nose. There's one that goes from here, goes here, one goes from here, goes there. So you are seeing the 2 cut ends of your cartilage that are sticking at your skin, and your skin is really thin there. So now how do we fix it?
How do we fix it?
So we have to pretty much put the parts back where they were.
Before my surgery, it looked like my nose had horns. It was sloped and collapsed, and it kept me from being active and doing some of my favorite things in life. Now after surgery, my nose has been reborn without the horns. It's cute and straight, and it makes me feel like I can take on the world.
Hi, how are you? Nice to meet you.
Terry Dubrow.
Hi, nice to meet you. I'm George. Nice to meet you. Spiro, Tiganis.
Spiro.
How are you?
They're twins.
Of course, they're identical.
Nice to meet you.
Yes. We used to be even more identical before the accident.
They are twins, but with that scar, it's very easy to tell George and his brother apart. And I don't know if I have the complete story straight. Were you riding a moped or a motorcycle?
It was one of the little moped things. I had a fever, so I was going to the pharmacy to get medicine. As I was driving, I sort of passed out. I drove into a steel fence. I woke up, blood was gushing out. I figured out, crap, I've had an accident. There wasn't a plastic surgeon in the hospital, so just a normal doctor stitched it up.
So it was an emergency room doctor, really, right?
Yes.
The emergency room physician was more interested in saving George's life than making his forehead look as cosmetically acceptable as possible. And that's where he should be.
When the scab fell off, that's when I realized there's a gap in between my eyebrows, that I have 3 eyebrows, and that this half of the eyebrow is halfway in the middle of my forehead.
You had this 3 years ago. Out of curiosity, how come you haven't had this fixed yet?
Well, the doctor said for the first year I can't touch it until it heals 100%. And my daughter's 1. I want to fix it before she gets older.
So she says, Dad, what happened to your eyebrow?
Yes, exactly. She still sort of points to it and touches it.
So why don't we go to the exam room and take a look?
Beautiful. Sounds good. Thank you.
It's one thing to have an abnormality that you could hide with your clothes, but when you have it in the middle of your face, you can't hide it. I just hope that we can help them. Let's take a peek. Lower your chin for us. So this scar, so you have a big scar. This actually is not bad here, but you have that big scar right in the center.
Yeah.
So your tissue is a little tight.
Yes.
To me, what I think is gonna be the safest way to go, just so that we have absolutely no tension anywhere, is to put something called the tissue expander in your forehead. So what we would do, the first stage, is most likely make an incision up here and lift up the tissue to create a pocket for this tissue expander. Put it down right in this area, and there'll be what we call a little port, a port that we can fill it, a syringe.
Okay.
It'll be underneath the skin.
Yes.
And then we're gonna come back, every week or 2 weeks and fill it up for you.
How big do you think it will get eventually? Like the size of a tennis
probably,
ball? Or?
Probably maybe a little bit bigger than a tennis ball, but something kind of like that.
My immediate thoughts of having a tennis ball sized tissue expander in the middle of my forehead is a bit embarrassing, but at this point I'm willing to do whatever I need to do to get the best results possible. I'm really happy to get these out of my head and out of my life. The scar bothered me, but not as much as having 2 in my head.
George, so here's a question.
Yes.
Did you walk around without a hat, like out in public?
I did a few times, and
And?
the reaction was pretty funny.
Like mothers hold their kids and run away from you, or what happened?
A few kids asked their mom, Daddy, Mommy, what's wrong with his head?
So you want these out?
I want these out more than I've ever wanted anything.
All right, we'll get them out for you.
Thank you. Before my surgery with Dr. Nassif, I felt like the poster child of what happens to you when you don't wear a helmet. My left eyebrow was in 2 pieces, and I felt really uncomfortable wherever I went. Now, since my surgery with Dr. Nassif, I finally have just 2 eyebrows. And I don't have to remember my nearly fatal accident every time I look in the mirror.
My name is Carissa. I'm 25 years old, and a dog ate a lot more than just my homework. I come from a 3-mile town in Bayonne, in New Jersey. I went to all-girls Catholic high school. I would always talk so much that I get in trouble. I don't know, other than that, I was a good student. I got pretty good grades. You could say I was life of the party. I'm not trying to brag, but I light up the room. Like, I literally make everyone laugh. And then a year ago, my life changed completely for the worst. We went to a friend's house, and we started, just playing card games, just hanging out. I was playing with the dog, sitting on the floor. I was about to pick up my phone. And the last thing I remember is my friend running up to me with a towel, holding it on my face, and then everyone was just going into panic. And I looked down, and I was drenched in maroon. It all blacked out. And then I remember waking up in the ER. I felt my face very heavy, and I'm like, something's not right. I remember my mom and my dad coming in. They opened the curtain. My dad started crying. He's like, I can't do this. And I just remember the nurse saying, all right, we're going to prep you for surgery. Let's go. Later on, when I woke up, I found out they were trying to reattach the piece of the lip that was taken off, but the skin was so damaged that they couldn't reconnect it. So that's when he decided to curve my bottom lip up to my upper lip. 6 months later, I had my second surgery. I looked in the mirror and I looked the same to me. Everyone saw a difference, but I didn't. I don't care what other people say. I need to see it. So when I went to my surgeon, I told him, I was like, well, I really want to be able to open my mouth. And he's like, I don't feel like it'll be able to open any more than it already is. That's when I had started Googling, top plastic surgeons. I clicked Dr. Nassif's name, and I see a little clip regarding why he went to plastic surgery, that when he was a resident in residency, a 6-year-old boy came in with multiple dog bites. And that's what made him really want to go into plastic surgery. And I was like, wow, if anyone really could help me or want to help me, I feel like it'd be Dr. Nassif. I want to be able to eat normal. I want to be able to wear lipstick. It's probably going to sound crazy, but the main thing I really want to do is take a nice bite out of a juicy hamburger. And if I could wear lipstick even doing it, that would make it even better.
Show me your teeth.
Okay, I'm gonna do something. So this is sharp.
Oh, okay.
That feel sharp?
Yes.
Okay, and this is dull. Close your eyes. Tell me if this is sharp or dull.
Sharp. Sharp. Dull. Dull.
That's good.
That's a good thing?
So that means that your
I guess I'm
sensation
all right?
of the nerve
Okay.
is good. Obviously, that tissue is gone. And the best way to do things is to take tissue from another area and move it over. And there's different ways to do that. The simpler thing to do first is we make a cut along where that tissue is, and we lift it up and go into your mouth. And we try to see if we can pull it out a good amount. If this doesn't work, a second possibility would be to do something called the superior-based nasal labial flap. In other words, we take tissue from here, lift it up, and insert it into that area. That's something that is a little bit more aggressive.
Yeah. It's a lot more aggressive.
But that is a possibility. If we're gonna do this, I have to think about it. So I'm not gonna give you a definitive answer right now, whether we do the simpler one versus just go for the big procedure.
After a few unsuccessful reconstruction attempts, I had lost all hope that I would ever be able to eat, feel, or look normal ever again. But now, thanks to Dr. Nassif, I could open my mouth more, and when I look in the mirror, I see my old self.